Good morning once again. Dr. Victor is my name, a surgeon at Chibuli Hospital, and I'm here today to talk about a new and different topic this time round. I want to elaborate more about hernias. I chose hernias because it's another common issue we have in our community. I want to continue elaborating and highlighting on the common conditions we meet in our community and some of the myths we have around these conditions. I want to help you understand them better so that you get better care or you improve your health. So today I'm here to talk about hernias. I'm sure we have heard about this word many times and repeatedly, and everyone understands it in their own way. We have had many myths around it. So basically, a hernia is when there is a defect. In our medical terms, we call it a defect, but I can simplify it for you, just call it a hole. So you imagine you have a hole in your shirt and something has where to pass because that hole is there. So when there is a hole, that is what we call a hernia. So in our medical language, that's what we call a defect. A hole is what we call a defect. So many times you have noticed that the commonest symptom people have when they have a hernia is that there is a swelling. When I get my clients, I always ask them that, why do you think that place is swollen, yet it has not been swollen before? So the reason is that there is a hole, so the contents inside you that are not supposed to come through or to protrude get a chance to pass through the hole and they protrude. That's why you see something swollen. So that is why we call it a hernia, or that is why most commonly people relate hernias with swellings. And usually that's what happens. When there's a defect, you'll get things protruding through, then you have a swelling. So the commonest hernias we see are the ones on the front part of the abdomen. I told you before, you like calling this the stomach, but we actually call it the abdomen. And the abdomen, to us in the health community, or to us health workers, the abdomen goes all the way down to the thighs, so to the mid thighs. So when the commonest hernias you will see are when someone comes with a swelling in the groin area, and that is especially for men. They tell you something is swelling and it is continuing up to my scrotum, and when I'm sleeping it goes away. Another common hernia we have is the umbilical cord swelling. So this is a very common one, and it has many myths around it. You see, the umbilical cord, more so than not, I think whoever you are or wherever you are seated in your sitting room or wherever you are listening to this, most likely you have a hole in your umbilical cord. Oh no, the umbilical stump. The cord is what they cut off when you are born.